Best-selling author Nicole Chung lost her adoptive parents to cancer and to diabetes. In her memoir, A Living Remedy, Chung explores her own complex grieving process and also how the healthcare system, in her eyes, failed her ailing parents. Author Nicole Chung joins me now. Nicole, thank you so much for taking the time to be with us. I know you through your first book, and in it you write so beautifully about the complexities of adoption. And now in this book, A Living Remedy, you say your parents' deaths made you feel like you were being unadopted. How did that complicate the grieving process?
I was really struck by when I began to lose my adoptive parents. I thought that my adoption was something I had mostly settled in my life. You know, I wrote a book about that experience and about searching for my birth family. And I was honestly a bit shocked by the way that my grief for them in their illness and in their deaths just brought up a lot of feelings related to that original adoption loss. It wasn't something I'd expected. I think when I used that term, unadopted, it was at like the depths of my grief. I think today I would probably not use the term, but at the time it was an emotionally honest expression of how I felt, just this feeling of unrootedness, given that the family I had been adopted into was essentially gone.
That unrootedness, I think a lot of people can identify with. And I think part of what is so resonant about this book is that it's a study of class and wealth inequality as much as it is about grief. You write, it is still hard for me not to think of my father's death as a kind of negligent homicide, facilitated and sped by the state's failure to fulfill its most basic responsibilities to him and others like him. What was it about the American healthcare system that was revealed to you in this process?
You know, people in this country spend so much money on medical coverage, and it's often a case of not getting what you pay for. Many people don't have enough coverage. You know, they struggle to navigate the health bureaucracy, and they still don't get the care they need. In my father's case, he was diagnosed with diabetes in his 40s. And for many years, you know, he would say he didn't really feel sick. And so he wasn't really thinking about the fact that healthcare was inaccessible to him during many of those years due to lack of insurance. Like so many people in my family growing up, we were uninsured, frequently underinsured. And it was one of those things where by the time his late-stage kidney failure was finally diagnosed, after years of not being able to access the ongoing care that he needed, the support that he needed, there had just been so much damage done. So I absolutely believe that his death was sped up by this lack of access to health care that he endured for many, many years, you know. And it's interesting because I grew up thinking so much about my parents' needs and their care as my responsibility, like part of what I owed them as their child, and something I don't think I had fully begun to grapple with until my father's illness grew more serious is just the limits of what we really can do as individuals within these failing, broken systems.